Hi there, this is Dermot here, and I'm just going to do another talk today on adverse childhood experiences. And why covering this when it relates to addiction and recovery is that I've noticed a lot of people who would be chronic relapsers or serial relapsers have a lot of issues that they don't address or probably don't even realize that they've had. Not that we're trying to re-traumatize people, or it's about getting them to just take a look or start to take a look at their past to see if there are any issues there, any experiences there that they might need to go back over and work through with a qualified trauma counselor. So this is just to highlight for people. So just what are adverse childhood experiences, what comprises of adverse childhood experiences, attachment issues, dissociation, impact of adverse childhood experiences, other exposures, the ACE pyramid, ACE attachment and substance misuse, how they correlate. Shame and self-loathing, and then self-care, and just to summarize it up. So what are adverse childhood experiences? Well, according to Young Minds 2018, adverse childhood experiences are highly stressful and potentially traumatic events or situations that occur during childhood and or adolescence. They can be a single event or prolonged threats to and breaches of the young person's safety, security, trust, or bodily integrity. So what comprises of adverse childhood experiences? In childhood and adolescence, have you ever suffered from any of the following? So neglect, physical abuse, sexual abuse, emotional abuse, living with someone who abused drugs and or alcohol, exposure to domestic violence, living with someone who has gone to prison, living with someone with serious mental illness, losing a parent through divorce, death or abandonment, and attachment issues. So from birth we form a bond with our parent or parents, especially our mother. I think she's given birth to us. This emotional bond form can decide how we grow as children. So it's what we attach to, how do we attach to our parents, siblings, etc. Children who are left or feel abandoned, even for a short period of time, can develop dysfunctional attachment issues. So especially a young baby, if a young baby is left in the cot crying for a significantly long period of time on a regular basis, can become dysfunctional. If the child is left, in the care of somebody else, for example, that can create that abandonment issues as well. The child will feel neglected. So children will internalize and think and feel that they are to blame, that their parent or carer doesn't want them, thus they have to do more to gain that attention. So they can act out at this stage, or go into themselves, withdraw. It just depends on the child. But a lot of the times the children think it's something that they've done wrong. It's not so much something that the parent or care. They feel that they're being pushed away. So this attachment can carry on into adulthood in the form of what we call codependency and interdependency. And again, you see a lot of this in addiction. Addictive homes, a lot of codependency there and interdependency, where each person relies on the other person for their own satisfaction, own emotional satisfaction. This will negatively affect a person's own self-belief, their own self-worth, and their own self-esteem. And just some examples of attachment issues: depression, anxiety, ambivalence about getting close to people, not wanting to be close to people, and an inability to be vulnerable or emotionally intimate around people, a preference towards isolation, rather go off on their own, A general belief that the world is an unsafe place, that's their core belief, and a preoccupation with the desire to have others take care of you. So again, that's the codependency or interdependency there. And if you've noticed, a lot of those issues are very similar to those issues of people who are in active addiction. So dissociation, when traumatic thoughts or feelings become too overwhelming to handle mentally or emotionally. It's a subconscious defense mechanism. Again, sometimes it happens, the person doesn't even realize they're doing it. It can be an out-of-body experience, feel like you're outside looking in, looking at yourself, going through whatever it is you're going through. Thinking and feeling that you're somebody else or an alter ego. And daydreaming or deflection, or even being in a trance-like state. And non-epileptic seizures. So impacts of ACEs. So just like attachment, experiencing ACEs can have an impact on our future physical and mental health, and often ACEs can be barriers to healthy attachment relationships forming for children. So some of the effects of ACEs on our physical and mental health are an increase in the risk of certain health problems in adulthood, such as cancers, heart disease, as well as increasing the risk of mental health difficulties, maybe violence or violent outbursts, becoming a victim of violence. Again, as I say, addiction can be part of that too. Pardon me. An increase in the risk of mental health problems such as anxiety, depression, PTSD or post-traumatic stress, and 1 in 3 diagnosed mental health conditions in adulthood will directly relate to adverse childhood experiences. And the longer the individual experiences an adverse childhood experience, and the more they are, some experiences, the bigger the impact will have on their development and their health. So if it's a one-off situation or one-off trauma, it might not have that big an impact. But if it's an ongoing thing like sexual abuse, can be ongoing over many years, will have a much bigger impact on the person. So some of the other things exposure to ACEs can impact the ability to recognize and manage different emotions. So not being aware of how you're feeling, not knowing what feelings, not being able to name feelings. The capacity to make and keep healthy friendships and other relationships, so unable to hold on to a relationship or a healthy relationship. The ability to manage behavior in, say, school settings. Difficulties coping with emotions safely without causing harm to the self or the other. And you see the pyramid there. So you start off in adverse childhood experiences and progresses to social, emotional and cognitive impairment. So the person will see the world differently in a sense, will see the world as a dangerous place, as I said there, be full of fear, maybe isolate. To cope as a coping mechanism, will adopt, health risky behaviors, addiction, that's where addiction will come in. To cope, the person will turn to drink or drugs. That can progress, as you say, disease, disability, social problems, so that progresses to that. And it does and can end up in an early death for the person. So ACE, attachment and substance misuse. So they all create huge shame and trauma. Up to 80% of people suffering from addictions have suffered from some form of trauma or might have post-traumatic stress disorder as a result of their childhood experience. Addiction can be seen as a form of dissociation as well as it is a chemical escape from reality and the emotional and mental pain that reality brings for the person. So to treat, ACEs and trauma when in early recovery is like peeling an onion. So you have to take out the outer layers first and work your way through to the core. So it's a very, very long and slow process. Okay. So addiction has to be treated first, and then time must be given to adjust to life and sobriety and recovery. So that's very important. don't be jumping in when you're in early recovery to try and get your, if you feel you're traumatized or have adverse childhood experiences, to try and uncover them. This could actually cause you to be re-traumatized, as it says there, and then it's a greater risk of relapsing earlier on. So again, as I say, addressing trauma too early in recovery could only re-traumatize the person. So you don't want to go there. It's about acknowledging that this could be a problem I need to look at down the road. So even following a 12-step program, a person who has suffered from an adverse childhood experience, severe trauma, post-traumatic stress, and even abuse do need further help to deal with and process their haunted past. So it is important to go back sometimes and look at your past and process it, put it to bed, let it go. This has to be done in a professional setting with a qualified trauma therapist and a recognized therapy. So don't go off and do it on your own. And as I say, you can't just forget about it and move on. If it was that case where you could just forget about your past, move on, that'd be fantastic. But unfortunately, if you're traumatized, it's there. You're stuck in a loop, and it'll keep coming back up. It'll keep coming back up. Times when you don't expect it to come back up, something could trigger it off. That triggering could lead you back to physical relapsing on alcohol, drugs, etc. So that's the risk. So it has to be dealt with, eventually. So shame and self-loathing. Shame is a major block in both addiction and trauma. And to overcome the shame, you have to accept your vulnerability and be willing to take an honest account of your life experiences. So it's just starting to kind of own yourself, own your feelings, becoming responsible, as I say, for your recovery in that sense. And it works to both as an addiction as well. Sorry. Accept that what happened didn't happen by you, but to you. So nobody asked to be traumatized. Nobody asked to be an addict. These are things that happened, So it happened, but you didn't do it. You didn't have a part to play in it. So you must remember that. A lot of people will, through the shame, believe that they had done something wrong, believe that they're dirty or they're bad, and that's the reason why they might have been abused. They might have been told that by the abuser or the perpetrator, that, that you're bad, and that's the reason why this is happening to you. Or if you talk about it, then you'll be punished, So those kind of things do affect the person. How they see themselves do affect their level of shame and self-loathing. So all survivors of both addiction, ACEs, and trauma were once victims until they took responsibility and got help. So yes, you're a victim, but once you take responsibility, you become a survivor, which means you got through it. Yes, doesn't mean that the problem goes away. You have a lot of work to do, but at least you're on the other end. So this can be a lifelong journey, but as long as you're on the journey, you're progressively healing. So it's changing I can't to I can. Self-care. So, as it took a lifetime to get where you are now, it too can take a lifetime on the road to recovery. So as long as you're taking care of yourself now, you're in ongoing recovery from both addiction and trauma. Everyone is different, as is their resilience and circumstances. So the important fact is that if you feel you need further help, you need to ask for it. So how? Pray to your higher power. That's what a lot of people get a lot of help from that. Give yourself lots of self-love and self-forgiveness, and believe that, you do deserve it. Even breathing techniques, if you're prone to anxiety or panic attacks, breathing techniques will help a lot. Breathing in for 3 seconds, and then out for 6 seconds, it will slower your heart rate. Your parasympathetic nervous system will slow down, and that can take the edge off panic attacks, anxiety attacks, etc. And then mindfulness and yoga is very important. If you can get into those two, join a yoga group or a mindfulness group and practice it on a daily basis, it has a huge benefit to trauma and and even for recovery. So I'll just summarize it up. So our past can be a major relapse trigger. It is important, as memories or nightmares come up, to at least acknowledge them and even talk about them in your peer group. Within reason, whatever you feel you can trust, however much you feel you can handle, or how much you feel the group can handle. You'll be surprised at just how many people in recovery suffer from ACEs and trauma, and it's very true. You know, it's up to 80% of people in active addiction will have suffered from some form of adverse childhood experience. So people will relate, will recognize, will identify. It's important to begin arranging further therapy support when you have about at least 6 months of sobriety or recovery behind you. And you cannot have a fulfilled life in recovery if you're still carrying around your past. Okay, well, that's that talk. Thanks very much for joining. I hope it has helped you in some way. All right, take care.